Okay, hopefully you can hear me. It's 7:01. We'll just give people a few minutes to drop in. I felt like my microphone is making kind of funny noises today. So is anybody hearing that? It's kind of on my end, it was making a weird noise earlier. Oh dear. Hopefully. Somebody just be brave and put in the chat box that they can hear me. That'd be splendid. If you can, be brave. Okay, good. I was like, I heard dead silence. Okay, it's great. Okay, I'm just going to give people a minute. Make sure that we're all here and comfy and ready to go. And obviously you should be able to see my introductory slide. And obviously everybody knows where the chat box is by now. If you're new to these webinars, there's a chat box on your right. You can type a question in if you like. You can also contact me after the session. Works best if I get it to resonance-wellness-education@gmail.com. Or at the office too, if you know the email there. Usually, if I have a chance, I'll answer your questions as we're going along. And if I don't, I'll leave it to the end and try and answer them for you. So don't give up on me if I've passed the slide of your question. I hope everybody is ready for Christmas. I am not. I've been taking a year-long course, and I just last week managed to get through my final case, and then I apparently have a bunch of other stuff to do to be certified, and so I'm trying to get that done before the end of January. So it's been a little bit busy, and the clinic is very busy right now, which I very much appreciate, but man, it's been a lot. So okay, I think we got a good chunk of people. So let's get started. So hello and welcome to How to Combat Autoimmune Challenges Naturally. My name is Dr. Alyssa Gall, and I will be your guide this evening about all things autoimmune. And as usual, this presentation is given in the context of the whole life medicine model, which is the model that I use at Resonance Wellness when I'm evaluating your healthcare situation. So today we're going to discover that the root causes of autoimmune disease have a lot to do with the basic lifestyle medicine factors, especially the root cause review and the clean slate process. So once again, I may sound like a repeating record about the elements of lifestyle medicine. And in autoimmunity, we also have to consider the elements of align. And for those of you not familiar with this part, because most of our lectures are concentrating on the alleviate aspect of medicine, align is typically more of a workshop or in-person type of intervention. But in essence, what we do in Align is help you to learn what needs to change so that you have a transformational experience of yourself and your health. So learning to find center helps to prevent health problems from worsening or from occurring again. It's typically related to stress patterning and condition programs in the autonomic nervous system and the body's psychoneuroendocrine immunological response. So that's the mind, the nervous system, the hormones, and the immunity. So when you're looking at those aspects, typically we're looking at different kinds of stressors that you hold in your life. We're also looking at kind of an inventory of the energy changing health challenges like surgeries or injuries, dental problems, vaccines, chronic infections, other kinds of physical trauma. And we're also looking at how do we teach you to maintain a revived support system. So how do you maintain a clean living pattern that works for you? We're going to talk about a couple of these elements today, obviously, not in as much detail for each and every one of you that you would need, but I just always want to give you a sense that there's quite a bit. There's even 2 more steps after a line, so you can just imagine how exciting those are. So in the human, the immune system has this amazing ability to defend you against millions of different foreign organisms, foreign proteins from foods. The immune system can remember previous exposures to organisms. And if that organism or foreign substance is there again, the response is even faster. And you have 2 kinds of immunity involving the 2 main kinds of white blood cells, which are known as lymphocytes. So B lymphocytes, or B white blood cells, are responsible for what's known as humoral immunity. And that's where antibodies are produced against foreign matter. So antibodies can float freely in the blood and into the tissue. And B actually refers to their start in the bone marrow. That's why they're called B lymphocytes. And T lymphocytes are responsible for what's known as cellular immunity. And they're the cells that become programmed to kill your cells that are infected with viruses or other organisms, or cells that are cancerous. So T refers to their origin in the thymus. So that's the gland that is under your sternum, which is biggest and most active when you're small, and slowly over time gets smaller, actually. So once again, there's 2 kinds of immunity: antibody-producing B cells and cells that actually directly kill other cells, called T lymphocytes. So the actions of both of the sides of the immune system are responsible for what we're considering to be the signs of acute illness typically. So fevers, inflammation, increased mucus responses, tiredness, all of those are signs that your immune system is actively defending you against something it considers foreign. So naturopathically, we want to support these kind of responses and not interfere too much so that an immune process comes to a successful conclusion. It has been hypothesized that when the body actually can't successfully have an acute immune response, that what ends up happening is that you put it in a state where it's more susceptible to creating dysregulation. So the immune system can produce reactions against the tissues of the body as well. I think, just while we're talking about immunity, I just want to mention in terms of acute infections that there have been experiments that have shown that, animal experiments that show that if you infect like rabbits, I think it was rabbits in this particular study I'm thinking of, with an infection, and then you prevent them from having a fever, then in the studied population, 100% of those rabbits will die of whatever bacterial infection you gave them. It's really important that natural acute illness be allowed to take place and successfully resolve. So of course, we want to make you comfortable. We want to make sure that, you're not so full of snot that you can't breathe totally, but that's actually a successful kind of immune response. And what you'll find is that in people who get chronic diseases, a lot of that, that kind of acute illness response actually is something that you don't see in those people, or you won't have seen it for like quite a long period of time. So when somebody says to me, "Oh, I'm really proud, I haven't been sick in 10 years," to me, that's a problem. That
that tells me I should be looking for something that has become chronic, especially if little other things are starting to appear. So nearly 4% of the world's population is affected by one of the more than 80 different autoimmune diseases. So that's not even including autoimmune conditions, so things that are not actually considered a full disease process is probably closer to twice that many if you consider other processes. So the most common autoimmune diseases are type 1 diabetes, multiple sclerosis, rheumatoid arthritis, lupus, Crohn's disease, psoriasis, and scleroderma. So autoimmune diseases represent the third most common cause of chronic illness in North America. And although many of those diseases are rare, it's estimated that they can collectively affect between 5 and 8% of the North American population. And for unknown reasons, and I say unknown because I think the data, like all of the experimentation, is perhaps not there. There's not a lot of money in this kind of experimentation or this kind of study. The prevalence of autoimmune disease is increasing. So that's already a good chunk of people affected, and basically more to come. So now remember, I said that the body can produce antibodies against itself. But here's the thing, to a degree, we need some of those antibodies. They function to remove old cells, and they help you to keep each tissue renewing at the rate it's supposed to. It's just that you need them in the normal amount, just enough to clean up, not enough to damage things. So autoimmunity is the presence of too much immune activity against self-antigens or autoantigens. Here in this diagram, you can see the B lymphocytes from the bone marrow producing autoantibodies, and the T lymphocytes creating basically cytotoxic T cells. And what they do instead is they just have a lot more reactions against self-antigens. And in essence, what this does is it creates responses that activate inflammatory cascades and basically does damage to tissue. So if you use autoantibodies, so those are antibodies against self-antigens as an indicator for autoimmunity, what you'll find is there's many, many types of autoantibodies. They're directed against all sorts of different self-antigens. And if we test, we will find autoantibodies in most healthy individuals, quote unquote healthy individuals. Again, some of that is required because you need certain things in order to clean up damaged tissue, and you're damaging tissue all the time. And similarly, you're going to also find autoreactive T cells, although to test for those is substantively more complicated than to test for antibodies. However, in autoimmune disease, the reactions with the antibodies and with the cytotoxic T cells creates enough pathological or functional damage to an organ or a tissue that the tissue attacked really is becoming damaged. And as a consequence, you can get a disease. So it's actually the autoreactive components that are the cause of the disease rather than harmless kind of accompaniment to the disease. They're definitely part of the process. So again, I have patients in clinic who claim they're healthy because they're not symptomatic of anything in particular, or people who will claim they're perfectly healthy until they got diabetes or cancer or whatever. But this is not true all the time. And I wanted to show you a case in point. So since the beginning of the autoimmunity field, like I said, we use these antibodies tested in a lab to diagnose and monitor autoimmunity. And there are literally hundreds of different ones that you could order. The most common autoantibody test is called ANA, and that stands for Antinuclear Antibody. And it is exactly what it sounds like. It's actually an antibody directed against nucleic proteins in the cell. Of course, every single cell that you have has nucleic proteins in it. Now, ANAs are often found in the general population, even in the absence of obvious autoimmune disease. But this study here just illustrated this beautifully. These are the graphs from a study done in 2003 by a group who had access to frozen lab samples from veterans. They wanted to see if there were any warning signs of lupus before the disease manifested. So it turns out that in the U.S. Army, every time they take a lab sample from a soldier, they actually keep it. And it forms this huge kind of investigative group of samples for this particular but fairly large population. So this is what they found. And I'm going to quote this. They said, "Our results show that clinical lupus, or SLE, is preceded by complicated autoimmune changes that are usually underway for many years before diagnosis. Antinuclear, anti-RO, anti-LA, and anti-phospholipid antibodies appear first, followed by anti-double-stranded DNA antibodies, and then by anti-SM and anti-nuclear ribonucleoprotein antibodies. The number of autoantibody types continues to increase until the time of diagnosis and therapeutic intervention." So lupus then is the culmination of compound autoimmune abnormalities that begin simply, perhaps even as isolated immunologic events, and that spread and multiply until they're manifested as a potentially devastating clinical disease. So you can see here, it's very clear that things are brewing before anyone in this group ever got the diagnosis of lupus, or indeed before there was ever a symptom of the diagnosis, but that in both groups there were antibodies way before it was obvious. I also want to point out that this study was done 20 years ago, but it's clear that results like these, which really should be in the awareness of all physicians, are not often acted upon clinically. Part of that is because of limitation of treatment modalities. And some of the treatment things that we do conventionally in autoimmune disease have their own risks and their own sometimes quite substantive side effects. But it really strikes me in this study that you can see here, like the first manifestation of lupus, people have to have a certain degree of dysfunction before you even see that. And then the diagnosis is usually not made until even quite a bit later. So I would guess there's probably at least a 1 or 2 year lag for most people before they really first figure out that they have something going on. At least that. Now, there's been many theories about how autoimmunity starts, and this diagram shows one of the theories. It's the theory of cross-reactivity. And this slide shows how rheumatic heart disease is triggered. Lots of people have heard about rheumatic heart disease. So in this particular process, you get a strep in a susceptible person. So that's a bacteria, Streptococcus pyogenes. So you basically have an infection, then you make T cells and antibodies against a particular component of the bacteria. So when you have an antibody reaction against a bacteria, it's usually to one of the coat proteins on it, just like we've seen recently with trying to make antibodies to spike proteins on viruses. It's the same mechanism. It's just different molecules. And there's a big, long process to this, which I'm not including in this talk because it's kind of not, it's germane to this particular topic. But in essence, the thought is that you make these kind of antibodies to this M protein. And it turns out that, say if an organ of that patient, like in this case, the heart, has a protein that where the amino acid sequence or structure resembles the streptococcal protein, so the bacterial protein, your T cells and antibodies will attack both targets. So both strep as a bacterial infection and the lookalike protein in your organ. So you could literally clear the bacterial infection, but then rheumatic heart disease can develop. Does that make sense? So this is just one potential method. And we know that this does happen, but it's certainly not in all autoimmune diseases. And for the most part, we still do not know what truly causes autoimmune disease. We don't know the specific factors that initiate the process or processes ultimately leading to an autoimmune disease in any particular individual. They're definitely not all like this slide, but we do know about certain risk factors that are more likely in people with autoimmunity. So obviously the question is, why? Why is the immune system making this mistake and starting to hurt the body it's supposed to protect? It is quite likely that autoimmune disorders are resulting from interactions between the genetics of the individual, the environment, and the immune system. So when I talk about the genetics of the individual, what genes really do in a human being, there's really only two major categories of things. The first is they help you build the tissue that looks like you. And the second is they are the source of all of the enzymatic, like the enzymes, basically, that are doing all of your metabolism, which is no small task, certainly. But what's interesting about genetics, and I have to explain this often, and hopefully you've heard me say this before, that it's very rare to have a disease that's entirely genetic. In fact, there are really only a handful of diseases where you could really say X marks the spot, meaning you have this gene and as a consequence, you have a disease. One of the examples is cystic fibrosis, where you have a change in a gene that literally results in a protein that you can't clear out of your lungs. But most diseases with a genetic influence it's not nearly that linear or simple. And there are times, like we're going to see in a moment here, where genes can both increase and decrease your risk depending on what you're interacting with. So we also have to, like I said, think about the environment and the immune system. So here you can see a number of different recognized components in the triggering of autoimmune responses. So we can start here. I'm just going to start at tobacco exposure here in the upper left. So tobacco smoke contains a kind of dioxin, which has been shown to induce autoantibodies, probably due to the induction of cell damage when you inhale cigarette smoke. It's also very significantly associated with uveitis. Somebody asked me about that ahead of time of this lecture, and there's definitely a correlation between smoking and uveitis. Certain drugs also induce autoimmune disease, especially the biologic drugs, which is very ironic because those are the drugs that are often employed in autoimmune disease. But like I said, they definitely have their own far-reaching impacts. Vaccines can induce autoimmunity when individuals have poor responses, usually to adjuvants. And an adjuvant is basically something that's put into a vaccine to provoke the immune system. In fact, there's a Dr. Schoenfeld and a Dr. Agman-Levin. They coined the term autoimmune inflammatory syndrome induced by adjuvants. It's called ASIA. And this syndrome is characterized by both non-specific and specific manifestations of autoimmune disease. And like I said, an adjuvant is any substance that accelerates or prolongs or enhances antigen-specific immune response. So it stimulates the immune system, it increases the response to a vaccine, but activation of the immune system by adjuvants could trigger manifestations of autoimmunity. So the main substances associated with ASIA are the adjuvant squalene, which is a kind of oil that comes from sharks, aluminum hydroxide, it's a very common adjuvant in vaccines, silicone, mineral oil, guaiacol, and iodine gadolinium. So alum adjuvants, so that's an aluminum-based adjuvant, are often immune potentiators in humoral response in vaccine formulations. So Lots to think about there. Also, poor socioeconomic status increases the likelihood of autoimmune disease. The full reason why is actually not totally understood. It's likely due to poor food quality and increased exposure. So more likelihood of factory jobs or jobs that would put people at more risk of exposure to solvents and metals. Now, damage from UV light also is known to flare autoimmune disease. Under the right conditions, UV radiation can produce necrotic cells. And when you do that, you induce something called danger signals or DAMPs. It's a specific kind of protein that's formed in response, and it activates a certain type of immune response that could accelerate to autoimmune response. So some people will note in their autoimmune diseases that they're flared by sun. The data also suggests that autoimmunity can result from numerous immune pathways that are triggered by a plethora of microorganisms, like we already talked about. And in the case of things like multiple sclerosis, viruses like Epstein-Barr virus and measles virus have been implicated in humans, but a really precise causal relationship is really not yet been really clearly found. And I think this is probably mostly because we're talking about individuals, and it isn't always a clear, everybody gets this trigger and this gets the disease. This is one of the most confusing parts of autoimmunity, is that how a person comes to have it can be multifactorial, like you can see here, and really not clear, and often far removed from the appearance of the eventual disease, like we saw with the antibodies. Now, coffee consumption can increase or decrease the risk of autoimmune disease, depending on certain detoxification tendencies in an individual. So this is an example of how metabolic expressions can contribute to autoimmunity, and they can literally have a protective or a deleterious effect, just depending on what gene you have. And this is definitely known in coffee. Like if you have one aspect of the detox gene, it's actually preventative for certain autoimmune diseases. And then you have the other version of it, and it actually increases your risk by like several times. So many chemicals have also been associated with autoimmunity, including silica dust, silicone implants, solvents, diesel exhaust, etc. And I've written alcohol here, and interestingly, alcohol actually decreases the risk of rheumatoid arthritis. It decreases the risk of autoimmune thyroiditis and of lupus. So again, you can just see different kinds of things happening depending on what's going on with the person. Now, one autoimmune disease that we recently discussed has a pretty clear trigger. That is celiac disease and the trigger of gluten-containing grain. People who have celiac disease are definitely at a higher risk than the general population for developing one or more associated autoimmune disorders. And about 30% of adults with celiac disease have one or more autoimmune disorders, compared to about 3% in the general population. So that's substantially more. That's 27% more, almost 10 times. And celiac disease patients have a 15% prevalence of other autoimmune conditions compared to the general population that have a 5 to 8 prevalence rate. So the prevalence of celiac in type 1 diabetes patients is 5 to 7 times more than general population. So it just depends on what disease you're talking about, how much more likely it is. It's also a possibility that gluten can trigger multiple sclerosis. But interestingly, you don't have to have celiac to have wheat gluten be part of the origin of your disease. It's actually been shown that non-celiac gluten sensitivity is associated with triggering autoimmune disease as frequently or more frequently than celiac. So if you're starting to get confused by celiac, non-celiac, whatever, you just have to go back to the celiac lecture where we talked about all this in detail. And the ANA antibodies are elevated probably 24% of the time in celiac and 46% of the time in non-celiac wheat sensitivity. So you can see it's a good idea to rule out celiac and other types of wheat intolerance
if you have an autoimmune disease, because the avoidance of wheat could really have a big impact if that is part of your picture, given the relationship between these factors. Now, what you might also notice about autoimmune disease is the high number of itises in it. So we'll see arthritis or myositis or polychondritis, colitis, myelitis, arteritis, etc. And so what does an itis indicate? It indicates inflammation. So we call the disease or pathology an itis when inflammation is a marked part of the pathology. So inflammation is a totally vital immune response. It's part of the normal immune mechanisms that defend against pathogens, heal you from injury, and repair your damaged tissue. But if there's too much inflammation and the tissue involved never comes out of inflammation, the immune system becomes dysregulated, and it really changes your body's ability to do things like recognize those foreign invaders, and it puts your body on a high alert for prolonged periods of time. And this can cause lasting damage if the repair is not being supported by other elements in the lifestyle. So how do we calm inflammation? The most direct way is to change the diet. And this is where I always start sounding like a broken record. I think it's very important to know the best basic diet. And here it is again, the famous pie chart of how much of each food category to eat on a daily basis. And this diet, from a large population perspective, really results in the least chronic disease and the highest longevity. It is also not the typical arrangement that most people eat. So here you can see about half non-starchy vegetables, about 12% starchy vegetables and grain, not a lot in comparison to how most people do it. Fruit 12%, ferments 1%, so something like a yogurt or a kimchi or sauerkraut, salts and seaweeds 1%, and then 25% good quality fats and proteins, because usually those things come together. So we, generally speaking, I feel as a Western population still eat as though all of us are working on a farm all day. And some of us are. Certainly some of us are. But we really do tend to eat like we're really giving her. Now, this is the diet, like I said, that very generally speaking, if you ate like this, the chances are pretty good that you would really not suffer too much from a chronic disease. And in a way, from what we've just talked about, you can kind of see why. But I'm going to give you other reasons why. Now, I also want to just mention that metabolic typing is a great idea under these conditions as well, because you can get more specific about what you need to place in your fat, protein, carb categories. And that approach is really based on how your genetics are translating into your capacity to transform foods for fuel. And it's important because the way that you make fuel from food is linked to every major set of immunoregulatory molecules, the pro and the anti-inflammatory molecules, your neurotransmitters, the hormones that contribute to the experience of inflammation, etc. So if I have a patient with established autoimmune disease, I almost always typically do this first because it tends to get a bigger impact for the effort and helps us track how things are functioning at a cell level. It's also a good idea to rule out food sensitivities and allergies if there's an immune dysregulation occurring, especially if there's a suspicion of that or people have had reactions to things. So you can do a blood test that tells you how reactive you are to certain foods. And the more reactions you're having, the more the immune system is being called upon to create inflammatory reactions. So I remember in the beginning of my practice, a woman with really severe resorptive rheumatoid arthritis, meaning that the rheumatoid arthritis was so bad that her fingers were actually shrinking because the bone was being eaten away. And at the time, I don't actually think I knew about metabolic typing. I hadn't studied metabolic typing yet. And there were, again, we've made advances definitely in the last 20 years, but we actually did an elimination diet for this particular woman. And it turned out that dairy was a huge problem for her. In fact, she had done the elimination for a month. This is typically what we do, is we pull a food for a month and then challenge it. And on the challenge day,
The next morning she woke up. She actually, in that whole window of time, had of the month time that we challenged it, or that we avoided it, she had almost zero pain. And then the morning after she had reintroduced it, it was literally the worst pain she'd ever had. And even though she knew that, and even though she had such horrible damage from the inflammation, she refused to give it up. She thought it would be too much of an inconvenience to her family if she stopped putting dairy in their diets. So I've also seen, I had one young lady who, at probably about 30, very young, was literally at the end of the biological response modifying medications. So there were really no more medications for her. She was losing inflammatory control. And the interesting thing about this woman was she was a vegetarian, which usually is not a very inflammatory diet. But when we ran metabolic typing on her, she shouldn't have been eating avocados. And it turned out she ate about 3 or 4 avocados a day. And so she really hated me that I took her avocados away. But I convinced her a month would be a good idea to just try. And by the end of the month, we had inflammatory control back. So depending on who you are, diet can have such an amazing, and it can be totally different from person to person. There is no one autoimmune relieving diet. Like I said, we can ballpark what the healthiest diet is. And if you're kind of a little bit chicken about what to do about your diet, you can certainly start there. And I think that's a good model to have for prevention as well. But you really should consider, if you are having established autoimmune disease, barking up one of these other food trees. Now, there's one other reason why you should be eating better, and that is that poor food choices and allergies will aggravate problems with the microbiome and will increase intestinal permeability. So the gut microbiome, we've talked about this before, it's an ecosystem of organisms, so bacteria, yeast, funguses, viruses, protozoan, parasites throughout the digestive tract. It's most importantly, it's home to about 80% of our immune system. So this is a colony of helpful bacteria, and you get inoculated at birth. This is cultivated with breastfeeding and throughout early life. And actually, being breastfed is associated with a lower incidence of diabetes, celiac disease, multiple sclerosis, asthma. It explains the protection that breastfed infants get against early infections, and it has anti-inflammatory properties. It actually creates antigen-specific tolerance induction, so it makes a child more tolerant to foods that are being introduced. And actually, a great deal of breast milk is actually bacterial food. It isn't really even baby food. A lot of it is more bacterial food. So modern diets really wreak havoc on the microbiome. You're going to create shifts in bacterial populations that increase inflammation. And when you have inflammation, you have, like I said, increased intestinal permeability. This is otherwise known as a leaky gut. The gut wall is literally 400 square meters of a single cell thick sheet. It's held together by molecules that create what's known as a tight junction, kind of like a Ziploc bag around in between the cells. And it's a physical barrier, a chemical barrier, and obviously an immunological barrier. But if you create inflammation, that single cell junction can be damaged. And when you get a leaky gut, it allows the entry of antigens from the gut, so things that can trigger an immune response from the gut into you. And that can produce also local in the gut immune responses and systemic immune responses, because you can get enough of it coming into the circulation under the gut wall that your liver can't filter it all out, and it actually ends up in the systemic circulation. So there are multiple diseases that can arise or be made worse by a leaky gut, and that definitely includes the autoimmune diseases. It's been shown in inflammatory bowel disease, celiac disease, autoimmune hepatitis, type 1 diabetes, multiple sclerosis, and systemic lupus erythematosus, or SLE. Now, as we've discussed in past webinars, disturbances in the microbiome can also be caused by food poisoning, antibiotic use. It can also be very disturbed by stress. And many retrospective studies observe that most of the patients that suffer from autoimmune disease
will report an uncommon emotional stress before the disease onset. So stress modifies the microbiome in both animals and humans, associated with that increase in intestinal permeability. If you're a chronic water avoider, chronic water avoidance stress also increases intestinal permeability and decreases tight junction protein expression. That's been found experimentally directly induced in rats and mice. So I know you're not a rat or a mouse, but I just like to make a plug for water, as you well know. Now, metals are also known to create dysregulation in the immune system. So a high concentration of some metals can really overload the immune system, while conversely, a deficiency in a metal with nutritional value, like zinc as an example, can also trigger the onset of an autoimmune response. So there is a hypothesis that metal exposure from occupational and natural sources play a role in autoimmune diseases. And rodent studies have definitely identified an association between metals exposure and antibody production. And some epidemiological studies in humans have identified arsenic and mercury, so separately, not combined, as predictors of serum autoantibodies and autoimmune disease development. So it's probably because there could be metal-induced generation of reactive oxygen species, so kind of oxidative damage to tissues and organs and even the genetic material itself. Metals also kind of annoy T lymphocytes. This is one of the reasons why I put aluminum in vaccines, and that causes hyperreactivity to self-antigens. But of course, you can also get those kind of metals outside of vaccines. So many papers also evaluated the effect of environmental endocrine disruptors, especially on the thyroid gland, leading to thyroid autoimmunity. We talked about this before in the thyroid webinar many moons ago. And there's a higher prevalence of autoimmune thyroid disease in people living in polluted areas, such as near petrochemical plants, actually in petrochemical workers, also in areas that are contaminated with pesticides or with PCBs, polychlorinated biphenyls, or near aluminum foundries. The exposure to mercury in workers in chloralkali plants or swordfish communitors, so like consumers, so people who eat a lot of big fishes that have heavier metal contamination, have also been found to increase autoimmune thyroiditis. Vanadium has been shown to increase inflammatory responses. So you can see there's really a lot of room here for more studies. But in the meantime, you can test for heavy metals in the body. It can be done with blood, urine, hair and nail analysis can also do that. And if this is part of your picture, detoxification can obviously help if you're already symptomatic. Although some of this is going to be only trigger and not maintenance of disease. Granted, if you are toxic with something and this was part of your trigger, it'll be continually triggering. Avoidance is obviously better, and we were literally exposed to so many toxins on a daily basis. Pesticides, pollutants, water contamination. We also did a webinar many moons ago about this, and of course, there were some people who were very stressed about that. So, who shall remain unnamed. So, just doing the basic things, water filter, air purification, eating organic, non-GMO things, using toxin-free household items. These things are important aspects of overall health. And like I said, certainly it would probably help us in terms of the prevention and potentially even helping people with autoimmune disease. Now, if you're going to start a process, obviously you want to start by removing possible irritants. So removing things that are causing inflammation for you, toxins, low-grade infections if you know that you have them. And in functional medicine, there's kind of a 4-step process that you can use in helping to revise the gut. Step 1 is really, basically pulling things out that are not useful to you. So you're really removing possible irritants. That's kind of like the first step. The second step is once you've kind of got the food thing mostly under control, and you've got toxins mostly removed, you're basically replacing factors that you need to optimize digestion and replacing things that might have gone missing with so much tissue damage. The third thing is restoring the balance of your gut bacteria. And then the fourth thing is, and this usually takes the longest, is repairing things that, especially in the gut wall, that haven't been doing well in a process. And this reliably will also improve things. So, normally when we're making a plan for an autoimmune disease, we're incorporating aspects of these depending on who the individual is. Now, supplementation will not fix an autoimmune disease by itself. So supplementation should really be individualized with autoimmune disease because there's a few areas where the circumstances will actually differ. For one, different autoimmune diseases affect different tissues. So supporting the tissue that's being damaged with herbs or supplements really should be specific to that tissue. Secondly, the way that the immune system is imbalanced in an individual will have an impact. So there are amazing botanical supports for immune function. But if you use one that drives up the part of your immunity which is already upregulated, you can just make things worse. So, for example, there are a group of herbs like echinacea which drive 1/2 of the immune balance, and then there's things like green tea catechins and grapeseed extracts. They actually have an impact on a different part of the same teeter-totter of immune function. So sometimes people hear X, Y, and Z is good for immunity, and then they try and modify their immunity and can actually make things worse in these particular circumstances. Some of the botanicals actually look like bacteria. That's why they work to stimulate the immunity. And sometimes it just does not work when the certain condition is already established. Thirdly, like I said, if you have a toxic load, the support has to replace what also comes out that's essential to body function. So there's no metals detox, as an example, that doesn't also remove a certain amount of normal minerals that you require. Fourthly, if you're on a set of pharmaceuticals, we have to take into consideration what that drug is doing and how it's affecting not just your disease, but also the healthy part of your body. So a great example of this is prednisone. So super useful for getting people out of flares, very hard on the adrenal. Sometimes you have less pain and inflammation, but now you're tired and depressed. And there have been many times I've had to rescue somebody out of that. And fifth, the digestion might require a great deal of support that has to be built over time. So the results won't always be immediate, and there is a degree of patience that's required to achieve the full result, especially as you could have seen from that original diagram. It might be years of development, years in the making, what you're experiencing in this moment. Now, stress has also been shown to be associated with disease onset and disease exacerbations in rheumatoid arthritis, lupus, inflammatory bowel disease, MS, Graves' disease, as well as other conditions. Even in certain conditions like psoriasis, stress has been implicated in delaying the healing of lesions, even with standard treatment regimes kind of being equal. And it's also been shown that cognitive behavioral therapy that's aimed to reduce stress levels or some other psychological therapy is shown to be effective in influencing better outcomes in many autoimmune diseases. Part of this is stress is associated with an increase in pro-inflammatory response. You can even see this in post-traumatic stress disorder. Acute stress creates changes in inflammatory markers. Even child victimization is associated with elevated C-reactive protein levels by that time that person is even just a young adult. So this is, of course, one of the reasons that I always ask patients to work on their known stressors, because we can't separate your life from your condition. And aiming some of the intervention at resolving those stressors makes a very big difference in overall health and certainly in symptom experience. There's good data, too, that shows that patients with rheumatoid arthritis,
You can see things like heart rate variability as being independently associated with high disease activity, and also and smoking. So quitting smoking is a great idea. And then learning how to do things like heart math, which improve your heart rate variability. Heart rate variability is the pattern of acceleration and deceleration in your heart rate. And this can be easily taught. It's one of the most used research factors that is really an independent risk factor, meaning that if you have good coherent heart rate variability, meaning that you have learned how to improve the coherence wave of your heart rate acceleration deceleration, it's actually a better predictor of how you do as a diabetic than your blood sugar level is. It's a really amazing anti-stress training technique. If you have never heard me talk about this, or we haven't had a chance to discuss it, ask me about it at your next visit if you're a patient of mine, because this is a skill set that I think everybody should have. And it's definitely been shown to help in autoimmune disease as well. So like I said, autoimmune complications really develop over a huge period of time. And just like the healing process is not completed overnight. So when you begin to uncover causes and make appropriate lifestyle changes, it's really important to implement those dietary adjustments to ensure you sustain that health. And I'm sure some of you are hoping I would give a list of curative interventions for all of those 80 diseases. And I wish totally that it was as simple as that. But it really requires often a big and permanent change in your lifestyle, and also in your interaction with the other elements that make up your health. So I'm looking forward in January to talking about anxiety, although in retrospect, I'm thinking I should have done that this month because it's been a pretty stressful month for most people and Christmas is coming up fast. So, but here's what we're going to be doing in this next several months for the free Alleviate webinars. And I hope you enjoy it as much as I do. I'm hoping if you have, this is your first webinar, that you'll have a chance to come for those ones as well. I really appreciate doing this for you. I love how many of you turn up and ask me questions. It's great. I hope I didn't scare you too much today like I do normally. And I am hoping that if you have a problem like this, that we can sit down and further talk about it if you're not getting the results that you need. So, questions? Anybody have questions? You guys have been all quite quiet. I did see Teresa thinks that that was a very nasty toxin visual. It is a nasty toxin visual. Oh, yucky. No, nothing. You're all like complete autoimmune experts now. Now everybody's going to be experimenting with gluten. I can just see it coming. Not everybody has that problem, but where you do, it's creates a problem. Okay, guys. Well, if I don't see you before then, Merry Christmas. And I hope you have wonderful holidays and a little bit more rest. And we will be talking to you all soon. Take care. Oh, Teresa, you can come in and ask for metabolic typing anytime. It takes a half an hour. You just have to let me know in advance because there's some instructions that we do ahead of time. Merry Christmas to you too, Christine. You're welcome. Bye, guys.